Assistant Professor of Diagnostic Radiology, Portside University. I will talk today about an important topic, which is entorhinal cortex atrophy score versus temporal lobe atrophy score in diagnosis and degrading of Alzheimer's disease. مفيش. هو مفيش خالص أي حاجة. من هنا؟ خلاص. Alzheimer's disease is a major public health problem and the commonest cause of dementia in the recent century. Diagnosis of Alzheimer's disease depends on clinical history, neuropsychological examination, laboratory test, neuroimaging. MRI is the commonest imaging modality used in clinical practice for differentiation between Alzheimer's disease dementia from non-Alzheimer's disease dementia. MRI visual rating scale are the commonest tool used for evaluation of the atrophy degree of cerebral lobes and the whole brain. The most used MRI visual rating scales is medial temporal atrophy scale that used for assessment of the medial temporal lobe volume. Many studies concluded that MTA scale has high sensitivity and specificity in differentiation between Alzheimer from non-Alzheimer cognitive impairment. Many researchers have recommended that the volume of entorhinal cortex is affected by Alzheimer's disease earlier than the hippocampus. Nowadays, a recent visual quantitative scale was developed called the entorhinal cortex atrophy score, or ERCA score, that depends on the measurement of degree of entorhinal cortex atrophy. Aim of this study was to compare the diagnostic performance of ERCA score and MTA score in diagnosis and degrading of Alzheimer's disease. This was a case control study performed in the period between April 2024 to January 2025. The study included two groups. A study group that include 30 patients diagnosed with cognitive impairment based on mini mental state examination, and the control group included 30 normal individuals of the same age group. Inclusion criteria of the study, this for study group, a patient with cognitive impairment meets the Diagnostic and Statistical Manual of Mental Disorder, 5th edition of Alzheimer's disease, and for both group, individual aged 60 years or more. Exclusion criteria, patient with history of vascular or other medical disorder interfere with Alzheimer's disease diagnosis, patient with regular administration of medication known to cause cognitive impairment, known contraindication for MR scanning, or patient who refuse giving written informed consent. Methodology. All patients of both groups performed brain MRI using 1.5 Tesla machine. All participants performed conventional MRI sequence, including axial T1, axial T2, FLAIR, coronal T2, and diffusion images. All participants performed coronal oblique T1 3D magnetization prepared rapid gradient echo in Mirage sequence perpendicular to the hippocampus longitudinal axis. In coronal oblique 3D T1 in Mirage image, both ERCA and MTA scores were assessed in both sides, and the results were compared to the mini-mental examination of each participant. First, we assess the ERCA score. ERCA score 0, there is no abnormality. ERCA score 1, there is mild entorhinal cortex atrophy, mild parahippocampal gyrus atrophy, and collateral sulcus widening. Score 2, moderate entorhinal cortex atrophy, moderate parahippocampal gyrus atrophy, with detachment of the entorhinal cortex from the tentorium cerebelli, what is called tentorium cleft sign. Score 3, there is marked entorhinal cortex atrophy, marked parahippocampal gyrus atrophy, and wide space between tentorium cerebelli and entorhinal cortex. According to META score, score 0, there is no abnormality. Score 1, there is a mild widened choroid fissure. Score 2, there is a moderate widened choroid fissure, mild temporal horn enlargement, and mild hippocampal height loss. Score 3, marked widened choroid fissure, moderate temporal horn enlargement, moderate hippocampal height loss. And score 4, marked widened choroid fissure, marked temporal horn enlargement, and marked hippocampal height loss. In our result, there is no statistical significant difference in between study and the control group as regard the age and sex of all participants. There is a statistically significant difference between study and the control group as regard MTA and ERICA score, with higher score was detected in the study group than control group. Both ERICA and MTA score demonstrate high accuracy in diagnosis of Alzheimer's disease and differentiation between the study and the control group, with higher accuracy was detected more in the MTA score than ERICA score. Also, a score of 2 or more is a best cutoff point for a diagnosis of Alzheimer's disease and differentiation between the study and the control groups. Also, ERICA and the MTA score achieve or demonstrate statistically significant difference in differentiation between mild versus moderate cases and mild versus severe cases, but no statistically significant difference between moderate to severe cases. Sorry. الماوس فيه مشكلة يا جماعة. ممكن حد الاستئذان. مفيش ريسبونس.
الايه؟
تحت Also, both ERICA and MET score demonstrate high accuracy in grading of Alzheimer's disease, especially mild to versus moderate to severe cases. Higher accuracy was detected in ERICA score more than META score. Finally, in conclusion, ERICA and META score are reliable methods with high accuracy in diagnosis of Alzheimer's disease. A cutoff score more than or equal to demonstrate high accuracy for diagnosis of Alzheimer's disease for both ERICA and META score, with higher accuracy for META score. Also, both scores demonstrate high accuracy in differentiation between mild versus moderate to severe cases of Alzheimer's disease, with high accuracy for ERICA score. Finally, we welcome you to the place where the Mediterranean meets the Red Sea, the city where the bridges the continents of Africa and Asia. Welcome to the resilient city of Port Said. Thank you.